And before we start his lecture, we're going to talk a little bit about Professor Milos, okay? Because I always like to take these big names of plastic surgery and rhinoplasty surgery, like Professor Milos, and understand uh, what uh, what makes them so great. Okay, not only great technically speaking, but their mindset. So, Milos, could you please tell us start telling us a little bit of your journey? How did you start in plastic surgery or rhinoplastic surgery, and why rhinoplasty? Why? What is about rhinoplasty that you love so much and you study so much?
Yeah, it's a very, very good question. And I will tell you honestly what happens. And everything is about good piece of meat, about one entrecôte, and it's not a joke. I'm an ENT and a facial plastic surgeon, and I was born. I will show you some slides. The slides are good. It's
Great.
worth it to see. So, oops. I will try to open it. So this is the first part of my lecture. I was born in a country called Serbia, in a former Yugoslavia. Actually, I was born in a country called those days Yugoslavia. Now it's called Serbia due to some turbulences, political turbulences there. And I spent 27 years of my life, and it's a great country. And I studied in Belgrade, Serbia. I was working there for a few years in a university hospital of Yugoslavia in Belgrade of Serbia, in the ENT department. But I was more interested in cancer surgery in those days. But partially, I was also interested in facial plastic surgery. I moved to Hamburg, Germany, which looks nowadays, it's cold now, looks like this. But back to the sunny side, I went to Hamburg in the 90s and I got a job in the ENT department and a facial plastic surgery in Hamburg, Germany. And then I started to be interested in this operation like rhinoplasty. It was a very, very challenging and demanding for me. And I was doing neck dissections, I was doing cancer surgery, laser surgery, endoscopic sinus surgery. I was doing a lot of middle ear surgeries, and a lot of things, and a lot of rhinoplasties. And one day, I went to Geneva, and I asked one guy in a hotel, where should I go to eat? And he asked me, yeah, you should go into a restaurant, call it Entrecôte. They have an excellent meat. And I went there, and they had only one meal, only one. There was only entrecôte, a piece of meat, a huge wine list, and this was a spectacular piece of meat. The restaurant was full. And I came 2 days after. I had a lunch again, and I said to myself, look, you should do one thing in your life, one thing, to concentrate on the one thing. And I decided what should be the most challenging operation for me? What should be the most intellectual? What should be the most demanding? And I decided to do the rhinoplasty. And it was 2002. And then from 2002, I started to do only this thing. And in those days, 2002, my self-confidence about rhinoplasty was much higher than now. Now I'm doing more than 300 rhinoplasty. But when you start to do surgery, nose surgery, rhinoplasty, you learn to be humble. You learn to be humble. And you should learn not only how to operate, you should learn whom you should operate on and who you should try to avoid. And this topic about psychology is incredibly interesting. And this is very, very interesting topic. And 16, 17 years ago, I started my private practice where I'm doing only rhinoplasty. And I learned in Germany, but it wasn't enough. It wasn't enough. Definitely it wasn't enough. So I went to US, and met two guys. They had a major impact in my life, especially my Rhinoplasty life. This is a Roland Daniel and the Dean Toriumi. And I'm mainly, especially when it's about secondary cases, I'm a big fan of Dean's way of thinking. And his results for me are spectacular. For me personally, the best results that I have ever seen in the meetings. And I can strongly recommend his book. This is,
Yeah.
And I went to see a lot of other guys, like and became a friend of a lot of them, like Rick Davis, who is a spectacular, great surgeon. Rick is also, he's got a very, very great impact on me. And then I met several guys in Europe and several guys also in from the US, and we created some kind of group. This is we made like a joke, International Rhinoplasty Research Society. And this is a Charles East, Guxel, Olivier Gerbeau, Aaron Cousins, Rick and Roland are there, George Marcel, Vitaly Zholtikov, Yves Seban, and Peter Palhasi. And we created some kind of think tank that worked together, and we spent 3-4 days after the meetings together, and we exchanged a lot of ideas. And the purpose of those meetings are every one of us. He's doing a lot of rhinoplasty, and every one of us is still not satisfied with the very end, till the very end. And I said, okay, I'm doing this. I started with transplanting fat in the nose, diced fat with a platelet-rich fibrin. What do you think, Guy? And some say, others say, oh, it's a good idea. Dean is doing like a Mista and this and this. And other guys are doing some other implants. It's very, very important if you have a few guys, because you can see an object in the same moment from all those corners. And it's very, very important to have a few guys who you trust to. And I still also, not only in this group, I have a very, very frequent conversation exchanging my mind with Dean, who is a great guy, and Enrico Rabotti also, who is I had with Enrico great talk few days ago about some new things, new ideas, and the two guys that are passionate. It's a rhinoplasty is obsession. It's a special kind of surgery. You're not never ever going to have some kind of satisfaction, and never to feel such a misery when you fail in a rhinoplasty or when the result is not good. And this exchange, this whole rhinoplasty community is a very, very interesting, very spectacular. This is a great part to be part of this team.
Yeah, I totally agree. And it's so interesting because talking very briefly before you start your lecture about mindset, we were talking some minutes before we started live that you're because of this journey that you talked about, you lived for so many years in Germany, but your origin is from your home country, and of course this have good influences in your personality, and your personality you transport for your surgeries, of course. Okay, so when you're doing the surgery, how is your mindset when you're doing a difficult case or a challenging case? How do you feel on that moment? Because as we all know, rhinoplasty is always a challenge for us, right? And that's what moves us to study more and more rhinoplasty. It seems that we're addicted to rhinoplasty.
I will tell you what every one of us has a different mindset. And my personal mindset in the rhinoplasty is more a Japanese one. It's more Zen. I try to get into so-called beginner mind. I try to forget a lot of plans. And when you play piano, after 10, 15, 20 years, you can start with an improvisation. You're not doing just on the note. And I can go into this flow to feel the tissue and just to improvise. there are two expressions when you go to visit a city. For the first time when you go to Hamburg, come to see me, you will spend a few hours on yourself. There are two options. You can take a map and to go like a soldier following the map, or you can work in your mind like a flaneur, to follow the beautiful street and to rely partially on your intuition. And my mindset, when I started to understand a little bit of rhinoplasty, everything what I was trying to say, okay, in all those books, everything is great, but there are several problems. And if I do it like it's written in this book and I fail, that means I have to change something. And then I have to go again in this so-called beginner's mind and to be like someone who don't know a lot and to try to think for myself, not like it's dictated by some people and their minds. And this is the way, how can you open yourself for a rhinoplasty? And the very, very important thing is, it's also Zen. When I'm doing my body work, I'm present, only there. I don't think how can I deal with a tip. I don't think is some guests are coming to my home. I'm definitely only there. And that's what I trained. It makes me a much better surgeon. This is what gives me concentration. The other thing, what Roland told me, is so Milos, last 15 minutes of the surgery are those 15 minutes which decides if you can present this nose on the pictures of this nose patient on the meetings or not. Because sometimes those last 10, 15 minutes, then where I go on a higher level of focusing and try that I always have some kind of little bit more battery for those last 15, 20 minutes to be more present, more focused, more concentrated, to give my very best and to say, okay, this is okay, I have to go. No. Those 15 minutes are the best one. And this is where you should try to give your very best.
Yeah, that's amazing. Yeah, that's amazing because I always like to ask our guests how their mind works, just like I'm asking you, because there's some little tips and tricks that makes a lot of difference. Because and it's always about. I always say that the same way you train your body in a gym doing workout, you train your mind for difficult situations or for challenging situations, and we have these situations every time in rhinoplasty. Yeah, just like you said, maybe on the last 15 minutes you're already tired, but that's the moment where you have to concentrate in
in the last 15 minutes you should be the most present one. Your mind should be ready and fresh.
That's great. And I remember one very brief case here when I was watching the interview. He was doing a very, very difficult case, and he was putting difficult suture, and then the cartilage just broke a little bit of the cartilage, and he was like Zen. Well, nothing was happening that time. And for me, it was, oh my God.
I watched things several times, and I was blessed, literally blessed that I could learn so much from him, and then I could observe him live. And this is this energy and this aura which Dean has, and we shouldn't be ashamed to say, look, he's a great surgeon. A lot of surgeons are sometimes afraid to talk good things about other surgeons, which is for me, you should always be honest and say, look, those great guys. And I learned a lot from Roland, from Rick Davis, from Olivier, from a lot of other guys. And you see, for example, Enrico, when you see his huge, how meticulous is he doing? This is this is, there's a lot of great surgeons, and a lot of people they're known. But I can imagine that in a South America there are spectacular surgeons there that don't present their things.
Yeah,
I
yeah,
learned from about this guy Devas from Brazil. I heard from 1 year ago. It was Mario Ferraz who presented me his work. I will show later this brick, what
yeah,
he's doing. It was like, oh, wow, interesting. And Ishida,
yeah.
he's a great guy. And he's doing a lot of things. Very, very interesting.
Yeah, that's amazing. So now we have almost 200 people watching us, and
Wow.
I think we can
We can,
uh, start. And the last thing I want to say that the best thing about these master classes and the lives that we do with guests like you is here we have opportunity and time to understand these things and these details about your mindset, how your mind works, and how you proceed in difficult situations. And this we don't have time in the meetings to talk about that. In the
there's a
meetings,
lot of things to say, a lot of things to say. As you, as Dean, as a lot of other people, I try to keep my body shape. I never drink alcohol evening before, never, never. There are some exceptions, very, very close, important friends from colleagues are coming. I can just take a sip of wine, but I don't drink, and I go always very, very straight in the bed. And I'm honest there.
yeah,
I don't want to be a hero. If I'm going to the surgery with a 5% less concentration, I'm going to miss some very, very important point. This chess
yeah,
game, like a rhinoplasty,
perfect.
which is a bad mistress. Rhinoplasty is challenging. So
Amazing, amazing.